First of all, this is a very important topic about childhood asthma because we doctors have many things to say to the parents or family members of the child, because parents are often in anxiety or apprehensive about different aspects of childhood asthma, and as childhood asthma is a very common aspect. So this is a very important topic. I will start about what is asthma. So asthma is a long-term allergic disorder. So long-term allergic disorder that may occur in children as well as in adult. In that allergic disorder, there is narrowing of our air passage, and impaction on some material inside the air passage that causes more narrowing and difficulty of breathing air to introduce into the lung, and that is responsible for the symptoms of asthma. It is genetic. If there is family history of asthma in like parents, grandparents, siblings, uncle, aunt, there will be more chance of having asthma in children. If a child who have genetic potential or hereditary history of asthma or any history of allergy to child or parents, grandparents, or in a family, they are exposed to some kind of allergens. That is, this allergens triggers the narrowing of the air passage and release of some chemicals that is responsible for narrowing of air passage. What are those triggering factors? So what are the causes? That is, usual causes are like dust, fumes, pollen, molds, etc. Sometimes some food may cause precipitation of asthma, like frequent common are seafoods like prawn, crab, some vegetables like brinjals. That these allergens may vary from person to person. So this is the cause of asthma. Basic cause is genetical. If genetically potential child is exposed to some triggering factor, that triggers the symptoms of asthma. Very important, how do you suspect that your child is having asthma? What are the symptoms? First symptom is cough. Cough is very common in children, but in asthma, cough has some particular pattern. What are the pattern? Asthmatic cough is usually exaggerated during night time or early morning time, because our air passages are more propensity to get narrowed during this time, either night time or early morning time. This cough often have a particular sound, that is wheezing, and this cough usually severe, persist for prolonged period, about 7 to 10 days or longer. And the another pattern of cough is recurrent, frequently happen. If the intervening medicine is not given, the cough will be recurrent. Another symptoms, very important, that is difficulty in breathing. When air passages are so much narrowed that the breathing air is not gaining into the entry into the lung, that causes breathing difficulty or respiratory distress. Often older child may say something about chest discomfort or chest pain. So this is all about the typical symptoms of asthma, and one thing should be keep in mind that this episode or these symptoms will be recurrent. To diagnose children as asthma, we keep a history that these symptoms will be recurrent. This is not a one-time episode. This is recurrent. That recurrence may happen with the interval of days, interval of months. So recurrent history of some particular type of cough, wheezing, chest discomfort, difficulty in breathing will suspect maybe your child is suffering from asthma. We usually diagnose asthma by clinically, by history, proper history from family members, by examining the patient. There is very little role of laboratory tests to diagnose asthma. So very much history is very important about the family history of asthma or allergy that will lead to more chance of having asthma in children. Child having history of the symptoms I just typed just earlier, that is noisy cough at night time or early morning time, difficulty in breathing in older children, maybe chest discomfort, chest pain, that may be history of recurrence. There is history of recurrence. And when one episode occurred, that may prolong for a period of about 7 to 10 days or more. So our child even may have history of other forms of allergy like food allergy, skin allergy to insect bite or to exposure to any kinds of allergens or materials. So this will lead to diagnosis of asthma by doctors. And I said that there is little rolled out some laboratory reports like that. For if we do blood test and if it's shown that eosinophil counts of blood is high, that may support your diagnosis because eosinophils is a marker of allergy. And I have said that asthma is an allergic disorder. So in asthma, it is often seen that this eosinophilic count gets high. Then this supports the diagnosis of asthma. And another is very important test, that is pulmonary function test. But pulmonary function test is not done for small children. They are not capable of to do the test. This is for older children. If in pulmonary function test or lung function test, it is seen, objectively seen, that your child's air passage is get narrowed, and this narrowing is widened after application of some anti-asthma medication, that favors in diagnosis of childhood asthma. The mainstay or gold standard therapy for asthma in children as well as in adults is the inhalation therapy, that is use of inhaler or nebulizer. I am repeating, that is gold standard or mainstay of therapy in asthma is use of inhaler or nebulization. This is together is called inhalation therapy. There are other forms of inhalers like there are various form of inhaler like meter dose inhaler, rotahaler that will be prescribed for you by your doctor, what is actually suited by your child. But I am repeating this word 2 times because there are some doubts, apprehension about some family members or parents about use of inhaler. There are some doubts whether it will be addictive to your child, that will make your child's lungs weak. No, there is no chance of addiction, no chance of your child's lung gets weakened. This is nothing but a mode of therapy like oral mode, injection mode, eye drop, ear drop. This is nothing but a mode of medicine delivery to your lungs child. And these medicines are given to your child's lung directly by inhale air. That is why the medicine acts instantly, as asthma is an acute emergency condition. When attack will occur, this is a usually severe form. Child having severe form of cough, severe form of difficulty in breathing, and to relieve this, some medication to be given by some route that will act instantly to relieve your child's symptom. So don't hesitate to start inhalation therapy when it will be prescribed by your doctor. Another very important part of prevention, this avoidance of this trigger, very important. Sometimes we just emphasize on the medicine, but we'll see that child's symptoms are not getting controlled. There is recurrence and some symptoms are occurring and occurring. So the avoidance of this trigger, that is avoidance of exposure to dust, fume, pollens, the particular foods that may cause the symptoms, that to be avoided. Another few symptoms that may vary from person to person, not for all person, that some exercise, loud laughing, loud crying, that may also precipitate asthma. For those who have this type of triggering factor, that's also way to avoid, to control or prevent asthma.